it's been known since the very beginning of COVID, almost a year ago, that older individuals are at very high risk of very severe COVID and death from COVID. In Utah, we know that our data over the last year, 70% of the deaths from COVID in our state, which is now a total of 1,500, 70% of those 1,500 deaths have been in people 65 and older. So we know that age is a very strong risk factor for bad outcomes in COVID. So it's extremely important that older adults, at this point 70 and older, receive the vaccine as soon as possible. So to your point about whether individuals who are in this age group who have multiple chronic conditions or who may be frail or living in a nursing home environment, if they should receive the vaccine, frankly, all the more so, their risk may be compounded even more than just age alone. So the frailty and multiple chronic conditions is further going to accelerate the risk of bad outcomes from COVID, and all the more reason to receive the vaccine. In terms of side effects, the data that we have, although frankly we would love to have more data in the older adult population, the data that we have to this point suggests that the 2 vaccines that are now available are extremely safe and well tolerated, even in the very old individuals who have received the vaccine.
So you cannot get COVID from this vaccine. So people may have some symptoms, specifically more commonly after the second dose of vaccine. Also, that those who are younger seem to have more side effects after the second dose of the vaccine. But what those side effects are essentially, you can have fever, you can have some fatigue, you could have some muscle aches. I had some joint pains and muscle aches when I had my second dose. Essentially what that is your body's immune system mounting to this virus and your immunity building. And so those side effects are normal, are nothing to be worried about, usually happen within the 12 to 24 hours after the dose of vaccine and then go away very quickly. You can take Tylenol, you can take ibuprofen for them, but they are not symptoms of actually getting the virus or getting COVID from the vaccine. So there's no other infections or no other, illness that you can get directly from the vaccine itself. We hear often people say, well, I got the flu from the flu vaccine. It's probably the exact same phenomenon that's happening. It's your immune system mounting a response to the viruses and to the vaccine, and then it just makes you feel sick. So that is normal. There's nothing to worry about. And the good thing is with that, those side effects of the vaccine, they go away very quickly.
Just to add to that, so again, for the older adult population, the data that we do have suggests that those even mild symptoms are less common in older adults, still more common after the second dose. But since I'm older than Dr. Spivak, I can report that after my second dose, I only had a sore arm to report and none of the systemic symptoms. So, but the point being that the side effects are minimal, short-lived, and given the overwhelming benefits and efficacy that we've seen, certainly well worth proceeding with the vaccine.
Let's talk about first what some of these side effects are that have been reported. So folks have probably heard about the severe allergic reactions that I think, again, if you look at the rates that have been reported, it's 11 in a million. So very, very rare. But these are allergic reactions like swelling, itching, anaphylaxis, difficulty breathing. And these, again, have been very uncommon and have tended to occur in people who have a history of severe allergic reactions to other medications or other vaccines. There have been other, I don't want to say idiosyncratic, but very uncommon things that have been reported. There was a gentleman in Florida who developed sort of an autoimmune platelet disorder, so his blood could not clot, that was in timing related to the vaccine, still being investigated, but maybe related to that. But again, a very, very uncommon side effect. And then there are reports, I believe, in California, as well as some of these allergic reactions in one clinic who was administering doses of the vaccine, and I think less than 10 people who received the vaccine in that setting. And my take home for all of this is clearly we are asking people to report side effects and we're watching for these things to happen. So we shouldn't be surprised that we're hearing more and more reports of side effects, but they are extremely uncommon. If you look at the thousands and thousands and now approaching millions of people around the globe who are receiving these vaccines, these side effects are still, again, very, very uncommon. And anaphylaxis, the allergic reaction, which again is uncommon, but the probably most common uncommon reaction we're seeing reported, is a treatable condition. Everyone is supposed to be monitored for 15 minutes after their vaccine, which vaccine sites are doing, and are capable to treat anaphylaxis very quickly if it occurs. And I would also point out the rate of these side effects, again, many of them treatable, are far less common than the rate of getting COVID. And so I think if you weigh the risk and benefits and the likelihood of having a reaction versus having COVID, and for some people having severe complications from COVID, unfortunately, with the amount of disease that we have around, many of our patients and populations are more likely to get COVID and potentially have a severe bad outcome from it than they are to have a severe side effect from the vaccine. So just remember, again, things that are in the media and things that are in the news sometimes seem more common, but you have to really look at the numbers and look at the thousands and thousands of doses that have been administered and how uncommon these side effects are. Many beliefs are sort of entrenched, and you don't want to, I encourage people to be wary of pushing people away and not bringing them to information or to accepting, sort of information and expanding their knowledge by seeming judgmental. So I think that's the first thing to sort of point out. I will point out, and I looked at it this morning, that CDC's website on the COVID-19 vaccine is probably the best resource, I'd say, for healthcare providers and also for the general public. And that can be the kind of information that you could provide to a person like this as another, resource that they could read to maybe gain some more information. But just be cautious, again, about sort of finger pointing or trying to, I don't know, I guess sort of judge or preconceive where their beliefs are coming from, but maybe just try to direct them to the facts is maybe the best way to bring them around and hopefully accept getting a vaccine.
In addition to the CDC website, the American Geriatric Society, healthinaging.org, has very credible information about the vaccine tailored specifically to older adults. And I agree with Dr. Spivak that the main response is we need to provide education. There's been a lot of myth that's been circulating, and we need to do our best to get people the facts and the accurate science, the accurate data that have been published and are credible, and ask people to make their own judgments, but first make them or have access to the credible information available to them upon which they can then make their decision.
For a vast majority of these indications, yes, that you can receive the vaccine. CDC, again, has a great list of sort of questions like this where they talk about patients who may have some underlying conditions and what their recommendations are. And in general, broad overstrokes, the recommendation for most of these conditions is, yes, these patients can get the vaccine. And I would also point out that a lot of underlying conditions are risk factors for, potentially more severe COVID and bad outcomes from COVID. So we would encourage people with many underlying conditions, many underlying heart conditions, lung conditions, some autoimmune conditions, to go ahead and get the vaccine when it becomes available to them, again, to try and protect them from getting potentially severe COVID. I've been getting a lot of questions from my family, from school teachers and from various people who either have family members or themselves have had different diagnoses or neurologic conditions that in the past have been attributed to vaccines. Specifically, Guillain-Barré is a question that comes up a lot. And then also some other sort of questions that I've been asked. And the real take home here is that we do not have enough data at this point with these two mRNA vaccines for COVID-19 to know if any of these sort of idiosyncratic potentially related vaccine side effects are going to happen with this vaccine. I'll tell you in general that we don't suspect that. And if you look at conditions like Guillain-Barré, CDC and ACIP, again, their advisory committee on immunization practices, really says that there's not enough evidence to link specifically Guillain-Barré with the influenza vaccine, and that you're more likely to get Guillain-Barré or things like Bell's palsy from actually having influenza virus or a respiratory virus than you are with the vaccine. So again, if you go to cdc.gov, they outline all of this and this history, again, of labeling some of these diagnoses as vaccine attributable historically, and say, again, we don't have enough data with these vaccines for COVID specifically to say, but we would encourage people to get them. And at this point, we don't suspect that those diseases or those diagnoses will be related to this vaccine, as it's questionable that they are related to other vaccines historically.
As a grandparent, I can relate to the strong desire to be able to visit grandchildren and feel that there's safety. I'll ask Dr. Spivak to bail me out on the details of the first part of the question, which is what are the levels of antibody, or what's your immunity after the first dose? First of all, there are some specifics, or as I recall the data, the antibody levels are a bit higher from the Pfizer vaccine relative to Moderna after the first dose. But that there are very few data in older individuals about those antibody levels after just the first dose. You've probably seen a lot of debate about whether we get better coverage, more bang for the buck in distributing the vaccine more broadly and just do first doses. That's been pretty much discounted. That we really need to rely on the data, and the data are that the 95% efficacy of protection is after the second dose. To answer the second part of the question, then, in terms of when you can feel safe, the antibody levels that are achieved with that 95% effectiveness after the second dose are within 7 to 10 days after receiving the second vaccine. I'll be coming up on that in a few days, so I'm looking forward to crossing that threshold. With that being said, in terms of feeling safe, and Dr. Spivak alluded to this in the introduction, while I will be protected, we don't know if I could still spread COVID to someone who is not vaccinated or still susceptible, including my grandchildren. So to that end, the vaccine only protects me or the person who's received the vaccine. It doesn't necessarily confer protection to others that that person would be exposed to.
With the data that we have, it looks like after one dose, and this is again, sort of, I think, going out to the 21, 28 day mark when your second dose is due, it looks like one dose is about 50 to 55% effective in preventing symptomatic COVID. When you actually look at the antibody levels, the first dose does not produce much at all neutralizing antibodies. Again, the antibodies that we think are confer immunity or protection against the virus. And so, that's, and we don't know, even if, you produce those antibodies after one dose and you have, 50% protection, how long that will last. And the whole point of the second dose is to boost the sort of amount of antibody and amount of immunity that you have, and hopefully the length. We still don't even know how long the protection is after 2 doses, but you see significant increase in antibody levels and also protection against symptomatic disease. Again, as Dr. Supiano said, about 7 to 14 days after the second dose of the vaccine. So I think really, in the US, most people, agree we're not going to abort a 2-dose plan and stick with that. And I would really, I've seen several people, unfortunately, get infected with COVID after their first dose of vaccine, whether that was because they let their guard down, hard to know, but, I would definitely caution people between the first and second dose to really presume that you have no protection probably. And we want to be careful even after the second dose until we can get the whole population vaccinated and really try and wear masks if we're around our family and others who haven't been vaccinated. Between that first and second dose, you really, really need to be vigilant as well.
I was thrilled that residents in congregate living situations, whether that's a skilled nursing facility or an assisted living setting, were included in the guidelines that came initially from the CDC that those individuals would be included in phase one of the rollout for the vaccine. So ahead of what we're now talking about primarily, which is adults 70 and older. So that was great news, and we celebrated that. I think the reason this is being reported is that skilled nursing facilities, by their nature, have an organized nursing staff and a medical director and a standardized set of processes for delivering the vaccine to skilled nursing home residents. These facilities are getting the vaccine from pharmacies who are coming in and delivering the vaccine on a scheduled basis. So there's a bit better organization for skilled nursing facilities. I believe part of the question is then for individuals in assisted living or who may be in an independent apartment in a congregate living setting like this, they don't have the benefits of that standardized scheduling organization behind them to be able to help facilitate getting the vaccine. And I'll confess, I don't know exactly the details to this, but I believe that they are responsible for going to their county Department of Health or public health department website to sign up for an appointment for the vaccine. So they're, depending on the assisted living facility, they may not have the capacity to have a pharmacy come in on a specific day and deliver the vaccine. Those individuals may be obligated to, like every other adult 70 and older, go to the website to be able to schedule that appointment. So I believe that might be part of the reason why this is being reported about that difficulty. The good news is they are eligible. It's just that they may not have the same access from a scheduling perspective.
The answer is that this is still being looked at and studied and researched, but there is, again, it's not been peer reviewed, but some sort of preprint or pre-reviewed data that has been released by Pfizer, I believe, that looks like the Pfizer vaccine is protective against the B117 variant specifically. And specifically, what is of concern is these variant strains that have a mutation at the 501 spot that alters the spike protein. So for now, we think that the vaccine does protect against these variant strains, but obviously there is concern. This is what viruses do, is that they mutate, that if we don't get vaccine out fast enough and have enough people take it, that there may be further variant strains, or there will be, that develop that may escape the vaccine. But for now, it looks like these variants, from what we know, again, still being studied, but it looks like the vaccine probably does protect against them. We're still figuring out rollout. I mean, I'd say at our current pace, I don't know, end of 2021, we need to ramp up our vaccine distribution significantly, right? We're way under schedule for where it was anticipated or hoped that we would be by the end of 2020. And also there are in some pockets, as we've talked about, some of the misconceptions with the vaccine, there are some pockets of people who are, refusing vaccine and not wanting to take it. I think in some areas, 20 to 30% of people at this point who have been offered the vaccine. So I don't have a great timeline. I would suspect, and I sometimes think that question is coming from like, when are we going to get back to maybe life that was pre-COVID? I unfortunately would anticipate that 2021, I would just go ahead and mentally prepare that it's going to look like 2020 for now, and unless we can really ramp up vaccine distribution a lot faster in the coming months.
And while yes, we would love to have more long-term data on the vaccine, the data that we have on the long-term effects of COVID are so chilling that, again, weighing risk and benefit, the benefit side clearly outweighs. So first of all, just to reiterate the statement I made earlier, for older adults, 70 and older, if you are unfortunate enough to contract COVID, your risk of death is extraordinarily high. That's a long-term outcome that most of us don't want to anticipate or accept. But perhaps even more compelling, and we are collecting more data about this in people who have recovered from their COVID infection. And we're learning more and more about the devastating long-term consequences of COVID. And Dr. Spivak and I and others are other investigators at our university are involved in actively researching the so-called long haulers or the COVID survivor group and the many organ systems that are infected from, and not just the lungs. While the pulmonary effects are very substantial, there are substantial vascular effects on the heart and vessels, on the brain. We certainly are seeing effects on memory function and dementia developing and so forth. So we know that there are long-term sequelae from contracting COVID. Again, from a risk-benefit perspective, I would advise that you err on the side of the minimal risks from the COVID vaccine against the known risks long-term of even mild cases of COVID having long-term outcomes that we would very much want to avoid.
This is the most common question I think that comes up, and I appreciate people asking this. So we do not know, is the question, if you are 100% immune to COVID after getting 2 doses of the vaccine. What we know is that for the follow-up that we have had at this point, for 2 doses of vaccine, 2 doses of vaccine are 95% effective at reducing your chances of getting a symptomatic COVID infection. So that means knowing that you have COVID because you have a fever, you have a cough, or shortness of breath. What we do not know, because patients in these trials were not systematically tested for COVID, regardless of whether or not they had symptoms, is that we don't know if it decreases your chances of actually getting the virus, but being asymptomatic or not knowing that you have it. And clearly we know now that asymptomatic viral infection is a large contributor to our person-to-person spread. So we just don't know if the vaccine, again, is what we're going to call what we call like sterilizing immunity, that you are unable to get infected with COVID-19. And so for now, and until we can again get vaccine distributed largely enough across the population, the recommendation is really that you should not change any of your behaviors as far as social distancing, mask wearing, after you get the vaccine. Now, there are nuanced situations, and we got a question about a grandparent where I think, on a case-by-case basis, we could maybe I could make some recommendations about a safe way to maybe consider gathering with your grandparents if you didn't before the vaccine. But again, you still want to be very, very careful, and people should be wearing masks and trying to keep their distance from each other. So there's more to come on that as that's being studied at this point, but we simply just don't know. So please don't change your behaviors and keep wearing your masks even after you get 2 doses of the vaccine. No, we are not currently providing vaccine for anyone aside from employees of the University of Utah Health. So we cannot provide them to educators or any of our elderly patients. And my understanding is that it's currently all being done through the Department of Health. So we refer you there again, and to your local county's Department of Health is where you would go to get information about actual vaccine distribution, specifically in your county, because it does vary a little bit county to county about how to sign up and how to schedule appointments. And we don't really know at this point. There'll be more to come on this as far as our availability to provide vaccine to our patients and others in the community.